Wow, we're on the topic of innovation. Let's hear about something which is making it all possible. Digitization. That was kind of a mumble. Digitization. It's no secret that the impact of technology is transforming every industry, healthcare being one of them, of course. Our panelists tonight are some of the leading professionals in the field, and we'll be discussing how the benefits of digitization can enhance quality care for both providers and patients alike. They will be deliberating on the topic, digitization in healthcare. We are so grateful to our moderator who will ensure a constructive conversation throughout this panel. Please put your hands together to welcome Dr. Jacqueline Samuel, CEO of Resilient Healthcare. There she is.
We are going to cut our time to 30 minutes so we get back on schedule. So like the last panel, if you have questions for us, find us after. You guys ready? So I'll introduce myself first, and then I'm actually going to have everybody introduce themselves. I am Jacqueline Samuel. I'm the CEO, founder of Resilient Healthcare. We are a health tech company. We provide high acuity care in patients' homes. So we were one of the first hospital-to-home companies in the country. We started before the pandemic. And the silver lining with the pandemic is a lot of healthcare became digital, and regulations changed to allow us to be able to provide a lot more care in patients' homes. And so we've gotten pretty busy over the last few years, and I'm very excited to be here and talk about it.
Awesome. Hello, everyone. I'm Ryan O'Grady. I am a vice president and the New York Health social media lead for Fin Partners. For anyone who doesn't know, Fin Partners is an integrated global public relations agency, and we work across a variety of sectors. But for me personally, my role is to lead a team of content creators and digital strategists who help our clients across the healthcare space in various industries have the most engaging and comprehensive social media ecosystem as possible.
Wow, great. Good evening, everyone. My name is Akash. I am the co-founder and the chief operating officer for a new startup. We are in the field of providing ABA therapy services to kids on the autism spectrum. And we find ourselves to be greatly empowered by the new digital platforms and technology that is available, which we have been able to leverage to create systems and processes which help us deliver better services to kids. I'm so happy that I've got an opportunity today to share some of these with you. And I really hope that our inputs will make some kind of contributions to what you are also doing in your respective fields.
My name is Lee Jones. I'm the Chief Product Officer for Gozio Health. We are a mobile platform company. We build a mobile application that hospitals use. It's deployed in several hundred hospitals in America already, where we help the hospital engage with the consumer and connect with them more easily. It's built around a cornerstone of our world-class indoor positioning technology, which gives you sub-meter accuracy and turn-by-turn directions anywhere inside the hospital, so you don't get lost. I like to say that fundamentally we reduce cortisol levels because you arrive at your appointment confident and calm and on time and peaceful.
Okay, so the first question we have is, how does your company, how is your involvement in your company digitizing healthcare? But you guys already went through that, so we're gonna skip this one. Okay, digital health, it scares some people. We heard a bunch of people talk about AI and machine learning, and how can we foresee problems that might come from creating a digital health system, and how can we use a new digital health system to fix those problems? Any one of you?
I'll jump in. So I think from my perspective, like I mentioned, I work in social media. So a lot of the questions we have from our clients or the flags that we have from our partners is in regard to privacy. And I think we've heard a lot about that today in terms of accruing data and holding on to it and making sure it's stored properly. So we do that for social media in a very specific way because we want to make sure that social media is leveraged to ultimately benefit the patient. At the end of the day, I think that's what we're all really here to do. So I think if all of the privacy components are in place and the data is stored properly, the opportunities are really endless to create this digital health infrastructure that is so powerful. And again, my experience is largely in social media, but we've seen some incredible success, especially in the last few years since COVID, with various campaigns that help connect patients to doctors. And we have all of these success stories of patients and advocacy groups who are just so appreciative that they were made aware of a new treatment on the market or a new resource for their loved one. So I think there's incredible amounts of opportunity. We just need to be sure that the privacy rights are all in place.
Yeah, I think you are exactly right there. And to take on from where you are living at, to give you live examples of what we were doing, we have in the last couple of years, as the pandemic set in, observed huge changes in the way we are approaching healthcare altogether. Specifically in the field that we are operating in, ours is a very, very close connection and a one-on-one need that we fulfill for a specific child, wherein the technicians and the therapists are required to be in the same room at the same time and deliver them or upskill them and provide them those skills that are required for their social adaptabilities. With the pandemic setting in, all this format changed almost overnight. There were social distancing norms, there were COVID testing norms, you had to sanitize all these instruments and the things that you were using to deliver the teachings and the therapies that you had already planned for. To swing overnight was not possible immediately, but it wasn't impossible also. It wasn't impossible altogether. We were able to achieve this because of leveraging the available digital platforms like conference platforms, which have HIPAA compliant connectivities available in them. They allow you to interact with the kid while safeguarding the PHI. Now, we have already heard right since morning that there is a huge amount of data that is being collected in our healthcare dealings. Every time that there is an encounter, a client or a patient or a subscriber, anyone visits a doctor, it gets recorded as a visit and you have certain data about it. How you're going to use that data would definitely depend upon your needs and your requirements, how you're able to pull it out. Interoperability comes in play and all these things comes in play. However, it does not, or rather it should not hold us back from going further into this. Because with the advent of AI algorithms that are available today, we can do deep dive in research and bring out the best outcomes based upon our research, which will help everyone who's there. So I think it's a great thing that we are going towards more digitization in healthcare.
So Lee, you have a patient engagement platform and it is already working in hundreds of hospitals.
Yep.
And so how do you feel like that is going to empower the patient?
That's a very good question. We have a philosophy at Gozio Health. One is, in the world today, we all experience this where everybody shows up with more technology to help us all the time. Here's your technology, and now you have to use the technology. You have to figure it out. You have to learn it. We don't really like that way of working. Our viewpoint is technology works for you. You don't work for technology. And so our engagement platform and the way we work with our customers and the way we track things with users has to do with reducing friction and eliminating all the sticking points that occur across the entire care journey. So, it might start at the very beginning where you're wondering, how do I feel and which doctor should I go see? We help people select and find somebody. Then we make sure they show up on time, and then we help them make sure they follow up. There was a conversation in one of this morning's panels about this gap, the follow-up gap, right, where people don't come back. And so we can take advantage of the mobile phone, because many people have these, to work with people and increase the probability that they follow up so they complete their care journey and they actually come out healed. They don't just come out treated.
And so now that we're moving care to be accessible in so many different areas, they don't have to be in the hospital to get this care. They don't have to go to the doctors. Are you seeing that this is making healthcare more efficient for patients? Akash, do you want to answer this?
Oh yeah, I'm 100% on board with what you are saying, and in fact, do prove it. If you look at it, the kind of closeness that develops between shall I say, a medical care provider and someone who you are providing this care to increases every time that you have a contact with them. Digital platforms give us the ability to increase the number of these such contacts without actually having the physical need to be in front of each other. Now, this could just be a quick Zoom call, this could be a quick phone call, this could be over your dedicated medical applications and platforms that you are developing. Anyways, it could just even be a review of the previous therapies that you had asked them to perform, undergo, probably if they are on a weight loss regimen, did they actually do all those things? Just a quick checkup, and you don't have to interact with the patient for this. All you need to do is read the data out of the applications, which is commonly shared between the two of you, and you will have all these insights available with you. So you are able to be more in connect with the people you are caring for. And that, I think, is a great thing which is helping us, provided, again, we are able to leverage it within the guidelines that impact us and safeguard the data that we are using it.
And you have created an onboarding software that makes it more efficient for patients as well?
Yes. So we find that there are certain repetitive steps which each family or which each client needs to take while they are joining us for services. Now, instead of everyone going through these repetitive tasks, why can't we make a certain algorithm, a specific, let us say, workflow, which is available right at the time they contact us the first time? Now, irrespective of the fact that they do choose to go ahead with us for services or not, these are certain aspects or these are certain information pieces that we would always need from them. So this is collected right in the first contact itself. Moving ahead, if they do choose to continue with us for the services, we already have this data based upon which we can work further to create a more detailed assessment based upon physical one-on-one observations. If we do not come to that step, the data has already been collected through a process which is fully HIPAA compliant and is safeguarded.
So we have patient onboarding software, we have patient engagement software. We're seeing a lot more companies create things that allow patients to essentially initiate care on their own. And so, Orion, how can we leverage social media in the healthcare industry to reach these patients so that care can be initiated by them?
Absolutely. There are so many ways to go about it depending on what the specific goal is. But I think that the main objective for social media that we're finding to be such an incredible tool to accomplish this goal is the optimal understanding of a disease state. So increasing that awareness and that disease education. Because a lot of times when patients are just being diagnosed, if anyone has a family member or has personally experienced it, it is a very emotional time and it's very challenging. And a lot of times people, when they're trying to understand their diagnosis, the first thing they'll do is go to Dr. Google and social media channels, for better or for worse. But we have a real responsibility as communicators and in my instance, on behalf of my clients who work in the pharmaceutical space, to make sure that patients, when they're seeing content on social media, that it's credible and authentic and conveys a real sense of humanity. Because I think we all know that a lot of times when a patient is diagnosed with something and they go to a doctor, that doctor many times is already predisposed to recommend a specific treatment. They're going to prescribe based on their success metrics and their relationships with various marketers and sales personnel, and they might push that more than a treatment that could be a new fit. And that's not with malintent. A lot of time that's just a lack of awareness. So we want to make sure that we're using social media to arm and empower patients to have those conversations with doctors so they can advocate for their own health and feel empowered across their journey.
And Lee, you guys have a patient engagement software and it is stemming from the hospital. And so does this scare or inspire you in a sense of patients being reached on a social media platform versus from the hospital's angle?
I don't know. That's a very interesting question. I don't get scared by a lot of stuff, but it's sort of, you need to take a holistic approach, right? We do live in a digital age now where people have, there's a democratization and a sort of just a disparity in the way that people gather their information, right? Sometimes for ill, sometimes for good. People gather their information from different places. It used to be that you would talk to your neighbor over the fence. Hey, what are you doing for your blood pressure? Yeah. And so there's today you can be marketed to and targeted in different ways, and so it's a little scary, right? I worry about some of my older relatives receiving malinformation, in these ways. But overall, I'm hopeful because there's just a higher level of communication. And then specifically with our platform, we make it, for some of our customers who choose to integrate modules like this, the ability to speak more frequently with their care provider. And it's not always their physician, but sometimes it's an advanced practice nurse or someone like that. And they can say, hey, I saw a commercial that said I should take horse root or something like that to fix. And they can very quickly come back and say, no, that's fake information. You shouldn't do that. Please stay on your medication. We can't wait to see you next week at your appointment. And so the digitization enables us to communicate more. More communication always has upside and downside, but I'll take the downside for all the upsides I get from it.
So Orion, how do we fix that communication with patients? If, AI, machine learning, social media is very good about it. Healthcare is now entering that space. And we have data on people who are, they're searching, they have Parkinson's, they're searching a lot of different Parkinson's treatments. And pharma spent a lot of money to push a certain Parkinson's med, and now they're seeing this med, and it's really not right for them because it's not the right med for them. How do we make that better?
I think that there's not a one-stop shop silver bullet for that. I think it needs to be a collective understanding and appreciation across the healthcare industry of being truthful and being credible and ultimately putting patients' needs and ultimately their individualized diagnosis and their individualized state first. And I think a lot of what we're trying to do on social media is, of course, we are, for certain clients, trying to promote a drug, or we're trying to promote a advocacy resource for a patient. But in all of the language, we need to be sure that at least once or twice in every campaign, it's made abundantly clear that every single person's treatment journey is different. And you need to really advocate for yourself and pursue personalized care with your care team from start to finish, whether that's your surgeon, your oncologist, your dietitian, and making sure that there's this holistic approach. So we really just try to leverage social media to empower patients to recognize that what they're experiencing is not necessarily one size fits all. And having that disclosure in our campaigns as often as possible has been a pretty beneficial tool to not only be transparent, but to, again, help those patients understand that they have options.
So for the first time, probably in our industry, we're seeing a lot of big technology companies entering our industry. We've seen Amazon enter the healthcare industry. We've seen Walmart is trying to enter the industry, Samsung, And so that being said, will this be beneficial for patients? Do you think implementing more technology in healthcare be beneficial for patients and reduce overall costs? Will it really change the landscape and reduce costs, or will it just shift costs? Akash, you can take this, and it's probably, you guys can all take this one.
It's an interesting twist that you have added right at the last part of what you have said. Will it increase cost or will it just shift cost? Yeah, you're right about it. To immediately give a direct answer that it will lead to reduction of costs might not be possible. But yes, there is definitely going to be cost shifting. A watch that I used to buy, that I'm buying and I use it only to see time, is now also giving me an update about my health parameters. Is this a healthcare cost or is it a lifestyle cost? So yeah, there would be definitely cost shifting. But if you look at it in a different way, the ability of this watch that I'm wearing to share data with not only with my primary care provider or my primary care physician, but to all the healthcare individuals that I'm getting in touch with, maybe my nutritionist, maybe my gym instructor, anyone else. So this complete healthcare team gets an insight into what's happening or what is happening with my health, which would definitely make it better for us to do preventive analysis, to prevent certain kind of lifestyle disorders setting in, and may I be bold enough to say predetermination of symptoms and disorders which we can take certain measures to stop or even obviate going forward?
What do you think, Lee? What do you think, Lee?
This is tricky because you sort of are trying to get us to predict the future here, which is, I'm not going to fall for it, but I will look back into the recent past and then argue that there's probably some similarities. So we often see big tech, these large companies have incredible financial resources, and a lot of imagination and creativity. And so they decide to go try things. They dip their toe in different markets and different industries. Right? Amazon has aircraft. They're supposed to be a bookstore. And so if they're going to spend time in healthcare, I get excited by that from the standpoint of when a big company makes a big move like that, they raise awareness of the entire situation, and they drive sort of a general cognition around the problems that we're trying to solve in a way that smaller companies just don't even have the marketing resources to drive the public conversation. So I get excited when a big company comes in because I know they're going to illustrate the problems, and then they're going to propose ways to solve them. Maybe they will, maybe they won't. Quite often these big companies get disinterested when the profit margins aren't as high as they want, and they find out the regulatory environment is tricky and hard, and Congress people can't do everything they said they could do for them. And so they sometimes bow out. But having come in and disrupted everything and stoked the imagination and injected capital into the entrepreneurial community and things like that, usually really good things happen when a big company does that. We could go back in time and look at all the strange things IBM did over the past 80 years. And many times they came in. Kodak. Kodak is gone, right? Well, we think it is, it's not. But Kodak did all sorts of strange things that really invigorated healthcare and invigorated our economy and our culture. So I get excited when the big tech companies want to get in the pool.
And if I could just jump in on that, I agree completely, 100%. I find it very exciting. And I think we've talked a great deal today in a bunch of different facets about the importance of collaboration. So I choose to believe, and this may be cautiously optimistic, and again, don't want to predict the future, but in a situation like Amazon, so Amazon launched Amazon Care, it didn't really work out. There were a lot of reasons, and they decided that at the end of 2022, it's not going to be available. My hope, and again, I don't want to be too optimistic, but my hope is that as a collective healthcare industry, other companies like Walmart or maybe Costco down the line, Target, wherever it may be, can learn from those mistakes and cater and nuance their approach to fit into those white spaces that weren't met previously and course correct any errors or privacy issues that were going to come up. So again, I choose to believe that hopefully with the collaboration and the collective brain power across big industries, tech, small startups, we can actually find a system that works and help patients get treatment in a more accessible fashion.
Amazon also bought the biggest PCP, one of the biggest PCPs at the same time they shut Amazon Care down. And so I think partnering with people in the healthcare space was the angle that they changed, not so much that they didn't want to get into healthcare. Yep. So our industry, $4 trillion industry, 25% of that goes into administration. So $1 trillion goes into administration every year. Digitizing health, are we going to make it more efficient, and will it be admin efficiencies that we're fixing? Do you want that one, Lee, since you're already working with hospitals and they got a lot of admin costs?
Yeah, I'll take a stab at that one. So digitization sort of takes there's sort of a progression that probably everyone in this room has experienced in their lifetime, which is when it first came out, digitization simply meant we don't have paper anymore. We're digital. And so that was great. There was some strange contraption that you had to somehow interact with to get your data into the system. And then as time went on, networks started to exist, interoperability became real, we started to actually exchange. And I think the key to all of this is the theme, this theme has come up in almost every panel today, is how important it is to connect things and to collaborate together. And so digitization in and of itself is like water, or it's just a thing. But once you start to combine it with other things, that's when we really will see magical things happen. And what we care, I said this earlier, what we care most about is eliminating friction. So we are trying to inject efficiency everywhere we can in everything we touch when we work with our hospital partners to minimize how much their people have to work on our platform and do anything. We automate as much as we can. So we really want to attack costs. Apologies to any administrators out there. I know you need to put bread on the table, but your time and energy could be better spent guiding your system or your company, thinking about the future as opposed to manipulating tools so that data will flow. We want to make that all automatic.
Okay, I have our last question, and it gets us right on time with this conference. This generation is a YouTube-driven generation. I'll tell you, my kids are probably watching YouTube right now, and mom's on it, so super cool. That being said, going digital, are we now getting more younger generations involved in healthcare. Akash, I know you've worked with kids. You have pediatric services, and so
Yeah, in a sense, but let's not restrict this to generations as such. Digitalization or digitization is not purely in the arena or the realm where young kids and young people are playing. No, it definitely is, even with people who are probably as old as I am, or maybe even older. But yeah, digitization is helping each one of us become more, shall I say, focused in achieving what we have set out to get right at the beginning, right? When we draw out our day's plans. Just if you picture in your mind, a few years ago, someone going to the DMV's office to get a driver's license, the amount of wait, the amount of forms, the number of booths you had to circle around, it's all been reduced now. And once you check in there, you get a number, they get all your data, it's all cross connected. They can even verify your previous records in other counties and in other states, and then immediately you can get services faster. So in a way, anyone who looks at getting top quality, better medical care in future should be ready and prepared for digitization.
and that's a wrap. 4:50.